everybody. My name is Catherine Rutland and I am Clinical Director at Denplan and Simply Health. Very lovely today to be sharing my platform with Sue Boynton. It's the first time I've done one of these with somebody else, so it feels a little bit different to just my usual talking into my phone. I have a proper mic and everything, so let's see how it goes. Many of you will know Sue. She's obviously had several guises. So in her current role, she's an independent dental legal consultant. She has done a huge amount of lecturing, support. She has covered our CPD Essentials, the sort of ethics and legal part of that for the last few years. So many of you will have seen her present who've been to those events. She, of course, used to work for Dental Protection for many years as well, which I think was when I very first talked to her and knew her. So massive experience across the industry. So it's a real joy for me to have her here for my first interview. So welcome, Sue.
Well, thank you very much for that lovely introduction, Catherine. And as you say, we've known each other for a number of years now. And I think from different points of view, we both help dentists and dental teams in different ways.
And I think that's very true. And I think we have to fess up to the fact we've had a conversation before this meeting and before this podcast of what was relevant and very interestingly, the themes that I was seeing with similar themes to what you were seeing, wasn't it? And we thought we'd sort of talk about those a little bit today and explore that. And I think one of the things you were first saying was about, and we've both seen it, of people wanting to or considering leaving the profession earlier than they would have done before, and not just dentists, but their teams as well. So what have you been hearing around that, and what are you picking up, and some advice, I guess, really as well?
Yeah, that's a really good question. I think I've been hearing the same things as you have. And really, this isn't surprising because during lockdown, people are changing their views on all sorts of different things. It's their views on the way their life works, the way their family works, what's good for them and what's not good for them. And certainly I get a number of dentists and dental teams coming to me saying, I really don't know if dentistry is for me anymore. I thought I had another 10 years. I thought I had another 20 years in dentistry. And now my life's changing and I don't want to do that. And really, that's a huge step for anybody to think about. And the first thing I'd say when that's coming into somebody's mind is, it's okay to have that thought. Don't think there's anything the matter with you when you've got that thought. Talk to somebody about it, because until you're talking to somebody else, the thoughts don't tend to crystallize in your own head. And the first things I'd say to people to look at is, why has it come to this? And usually it's multifactorial. It's not usually just one thing. Sometimes it's about the way the practice is going. Sometimes it's about patients and people in the team. Sometimes it's not at all. It's about the business challenges of dentistry. Sometimes it's about elements of dentistry itself. And sometimes it's just about people's own thoughts. There's often a bit of, am I good enough for this? Do I need to be looking at something else? Should I be comparing myself with other people? I get that thing, and people laugh when I say this word, comparisonitis.
Yeah, that's a brilliant word.
People comparing themselves. Yeah, that's absolutely it. And I bet you have it, Catherine, sometimes, and I have it sometimes. I'll look on social media and I'll see somebody putting something on they've done, and I think, wow, they're doing so much better than me.
And I think that's the point, isn't it? Is that we all have it. We all have it. It doesn't matter almost, or maybe not everybody, but the huge majority of us have it at some stage or many stages through our career. And especially, as you say, at changing points when things are different or new work environments or challenge, it automatically throws those thoughts up into your head, doesn't it? And exploring them, as you say, is really important.
Yeah. And the people I see running into a bit of difficulty sometimes are the ones who daren't explore it with anybody else. They daren't talk to anybody in the family, because the family might then say, well, hang on a minute, you've spent 5 years training in dentistry, more than that once you've finished your undergraduate course, you've invested so much in this. Who are you to now say, hang on a minute, I think this might not be for me? So they don't want to put their families in a difficult position. They don't want to disappoint anybody. It's that personal disappointment, but it's the disappointment for other people as well. And I'd say to anybody who's getting that, do talk to somebody.
Yeah, and I think it's around as well exploring. Yes, there might be something you don't particularly like you say, when you've explored it and you find, right, what is it I don't like? And that might not mean that you have to stop the environment you're working in. You know, if it's a specific type of treatment, I've had conversations with people who hate extractions, for example, or hate doing root treatments. I was one of those with the root treatments, you know, but how do you then make sure that somebody else in the practice can do that for you? Why do you need to stop your whole career and be dreading seeing that in your appointment book, or dreading seeing that patient or that time span? And I think it's being upfront, as you say, and then there possibly are solutions that you haven't thought about on your own. And it's not just you feeling like that.
Do you know, you're absolutely right with that. Certainly when I first qualified, we were expected to do everything in dentistry. You'd be a general dental practitioner, and that meant you did everything unless there was anything really tricky. And then you referred it off to the local specialist, the local consultant. Dentistry's changed so much now that really, I don't think we can expect everybody to be really comfortable doing absolutely everything. And I've no difficulty if somebody says, as you say, do you know what, I hate extractions or I hate endo. Talk to somebody in the practice and see if you can make an arrangement where they do the thing you hate and you do something that they hate. It might be that they're not comfortable with children or ortho, something like that. Swap over between you in practices. And that can be a really good solution. I was talking to a dentist the other day and they said, you know what? I'd never even thought of that. I've just been fixed on this. I have to do everything. And if I'm not good at such and such, I have to go on a postgraduate course until I am good at it. It's not necessarily
no. And if you think about it, in so many other areas of healthcare, very few areas, professional areas, have such a wide base as we are expected to have as dentists. So why, as you say, why should it matter? It shouldn't. It needs to be a bit of a shift. And I think that's for people towards the end of their careers, but also for people early on in their careers as well. And it doesn't, I think the other side that you think sometimes it doesn't mean you have to specialize. There can be a tendency then to feel, oh, well, if I don't like it, that means I need to specialize in something. No, you can do most of everything and just take out those few bits you don't like. And I think it's exploring as well what side out of general dental practice will interest you about dentistry as well. As you and I know, there's a whole other world of dentistry that exists outside of general practice. And I think when you're in general practice, you feel like that's it. It's the be all and end all. You've either got to do that or quit dentistry. And as you and I well know, that there are so many avenues that you can still use all your information and knowledge, or maybe just shifting so that you do a day a week of something different. And then your clinical practice feels more, you can see what you're doing and you can see the wood for the trees a bit. I think, yeah.
Do you know, and that's absolutely right. And of course, we all thought that you had to work 9 to 5 in dentistry or even a bit more. And you don't now. And it's one of those professions where you can actually choose your hours. Depending on your contract you have and where you work, you can reduce them and focus on something else. And certainly that's what a lot of dentists are doing now. They're exploring what there is outside dentistry. And we've got so many skills. We've learned so many things from working in dental practices. I talk to dentists and they say, oh, so I can't do anything else. I've just got these skills. And then once we explore the transferable skills, you think, wow, I know a lot. I know a lot about communication, about managing patients, about managing a practice, about strategic planning, project planning, completion, that type of thing. Loads of people know about compliance, so they don't realise that they do until we start exploring it. So there's a whole world of things that support dentistry as well. Thinking about compliance, thinking about complaints, thinking about regulation, there's other opportunities for people there, as well as business development.
Yeah, and I think that's very true. I mean, I say sometimes about how, you know, when people ask me, well, what did you do to get to where I am now and my role in, it's not about my technical skills. It's about what I learned as far as exactly all of those things that you've just said, running a business, communication skills, managing people, all of that is, and that was all just learned from being in general dental practice, but it's actually not of course, my dental knowledge has to be there, but that isn't the core of what has got me to where I am now, for sure. So I think that's a really, really, really good point. I think we forget how how good we are. There's so, and I wonder whether maybe it goes back to that lovely word, that comparisonitis word, that especially with social media, you know, that the social media side is all about the technical, practical dentistry. Very often, isn't it? It's here's my before and afters, and that's the very clinical, technical part of it, and it doesn't show any of the softer skill set that is such an advantage.
I think that's absolutely right. And the other thing I'd say when people are sort of comparing themselves on social media is, don't forget, people show their very best side on social media. No one says, I did this treatment and look how terribly it worked out. I had to start again, or I had to get a colleague to help me. No one shares that. They will share the fantastic before and afters. So always think when people are showing things on social media, that's the very best thing they've had. That's the very best day they've had. I'll tell you something. The other thing I ask dentists as well when they're struggling a bit with whether they should stay in dentistry or not is a really good question, and I don't know if you use it, is tell me about a really good day in the practice. What would that look like?
Yeah.
And something really good often comes out about that. There's a bit of a good day. I'm thinking about the bad days, and there's, oh, wow, I really liked it when I helped the patient with this. I had a really nervous patient. I turned her around. You know, I had a child that needed this and I got them sorted out. I did this good crown and bridge work. There's all sorts of things. And the mind naturally focuses on what's not good. And it's quite a mind shift to suddenly then go to, hang on a minute, what is good? And if I like doing those things that have worked out really well, can I do more of those?
Yes, and that's really true. And I think it is that natural tendency, isn't it? And you focus on what was the negative. You have one patient that was a bit difficult or a bit challenging. That's what you remembered, not all the lovely patients that came in and all the lovely conversations you had. I mean, I know it. I still do it now. I have to remind myself, you know, that if I've had a difficult conversation with a dentist, or, you know, that actually, yes, but how much positive feedback have I had today as well? And it is a natural human thing, isn't it? But of course, if you're already worn down, tired, struggling in PPE, all of those kind of aspects, is much more difficult to step back from it and actually go, okay, yeah. So it goes back to that point that you said originally of you need to talk to somebody else.
Yeah. And you know what? As dentists, we still tend to be quite isolated. However much we're working in a team with other people. And as you say, we've got the phenomenal challenges at the moment of PPE, the different SOPs and that sort of thing. And people are just too tired at the end of the day. They think, yeah, I could do with talking to somebody, but everyone else will be tired as well. So no one will be available to talk to me. And I think it's realizing people want to help.
Yeah. And I think that is really true. And I think it's also, you know, I worry a lot, and we were chatting about this before, I worry a lot about the lack of CPD that you could, you know, the networking that goes with CPD. So not the CPD itself. There's some brilliant CPD webinars out there, as we well know, and we can learn all of the, as I say, going back to that technical, you know, very clinical side of it. But what people are missing out on at the moment is those chats that you have with an old friend that you bump into on a course, but you actually, because they're a little bit further away from you, they're not there, that you might start to open up and you might start to say something. Or, you know, you and I both know we've been in that situation. People have approached us and had conversations because you can, whereas to pick up a phone to somebody is that extra layer, isn't it, of exactly as you say, you feel like you're invading their time, and we're all, you know, I'm as bad for that as anybody else. And, you know, sometimes you think I really need to talk something. No, exactly as you say, they're busy. People have got enough on their plate, but people do want to help. You know, there are so many of us out there that really, I suppose, are so aware of the consequences if people don't ask for help as well.
Yeah. I think that's absolutely right. I tell you, one of the things that happened on one of the CPDs that I was on the other day was just a kind of open mic session beforehand when everybody was getting settled in and finding out how the chat box works and all this sort of thing. Instead of turning the microphone off, leave it on for 10 and 15 minutes and say, you know, people who want to have a chat with the group, they can do. People who want to have a chat separately, we can organise that for you afterwards. And it's just that general sharing of ideas sometimes to say, oh, I've got this real challenge in the practice. What do you do? Oh, we've done this and that sorted it out. You know, I tell you what I did the other day as well. I set up a focus group for practice managers, for just a few of them to come into that sort of chat. What are your challenges you're having now? What do you need, sort of thing? And I tell you something, they sorted out all each other's challenges. I didn't have to do anything. It's absolutely brilliant.
And that's the thing, isn't it? It is that having conversations with other people, that, and also people, you realizing you're not the only one going through that. I think that's really important, isn't it? It's that natural human nature of, I suppose it's one of the reasons we've all bonded through this pandemic in lots of ways, is actually we're all going through it. The whole country is having to go through it, and we can understand not exactly what everybody else is going through, but we've got a good idea because it's happening to all of us. But in dentistry, if we're not telling anybody we're going through it, you can feel like you're the only person that faces those challenges. And like you say, somebody else can solve it for you potentially relatively easily.
Yeah. It's taking that breath and having that first conversation, or sending that first email or message to somebody to say, can we talk? And most people are going to say, yes, of course we can. When's good for you? It's that.
And I think, sorry.
And as you.
And I think, as we were saying earlier, I think it's also making sure that practice teams feel that they can say that. There's enough of a recruitment issue within dentistry, in all levels of dentistry anyway. What we don't want is people leaving the profession, good nurses, good receptionists, good practice managers leaving because they haven't been able to have those conversations and explore potentially changing a little bit of what they do. I think that's as important as the dentists having conversations, isn't it?
You are so right. Dentistry is more and more a team game now. If you haven't got a good team, you haven't got a good dental practice. And it's having that time to have that conversation. And we've all done it. We've said, how are you? Fine. And you think, oh, thank goodness for that. I'll move on. And it's that space of having that, okay, how are you really? How's everything going? And it doesn't take long to have those conversations, but they are so important. Yeah. It's ideal if you can have them face to face. And if you can't, second best is something like a Zoom, where you can see somebody's facial expression, you can see their body language, and when somebody's not so good and they need a further chat.
And I think that's a very important point as well, isn't it? Because I think for you and I, we have lived on Zoom or Teams for the last 10, 11 months. But of course, for a lot of practitioners or team members, that's not the case. You may have had Zoom calls with friends and you may have watched a webinar and so on, but the interaction is not quite the same. And it is a slightly different platform to communicate on. It is different. We all went through it when we first were doing it all the time. You had to learn different ways. But for those of you who don't feel confident on it, believe us that it is possible still to have these really good conversations on a Zoom or Teams call. It doesn't mean that should be a barrier, I think, to asking for support, because those of us who are providing support potentially will have had more conversations, and as you said, Sue, will be picking up, oh, you're not quite right there, or because we've had to learn to do that over the last 11 months.
I think that's right. And I'd say to people who are nervous about things like that, give it a try. And you know what? When you go on Zooms and Teams like that, you can start it with your camera on, and you can always switch it off for a few minutes and then put it back on again while you get used to it. Somebody said the other day, oh, I don't like how I look like on camera. And one of these gurus said, you look like what you look like. And I thought, do you know what? That's absolutely right.
So true. Thank you, Sue. Really, really interesting discussion. It's been so great to talk to you today. I'm very, very grateful for your time. Thank you to everybody for listening. We're also really interested in your feedback. If you'd like to get in touch with us, please do email us at social.media@simplyhealth.co.uk. Love to hear from you. Any comments on today, but also any thoughts, any topics you'd like covered, anything of that sort. So I look forward to speaking to you again soon. I will be doing another interview in another few weeks, and thank you for listening. Goodbye.